curve the cut around the pulmonary artery. Now you can see the leaflets of the aortic valve. There are three cusps or leaflets. You can see the septum is smooth, and in the left ventricle there's no infundibulum, as there is fibrous continuity between the anterior leaflet of the mitral valve and the aortic valve. At this point you can take all your pieces of heart and put them back together and weigh the heart. We have removed all postmortem clot and most of the great vessels, so we can get an accurate heart weight. The measurements we do want to make on the heart that are important and should be done on every heart are the valvular dimensions and wall thicknesses. Again, these may not reflect what's going on in life, but it's the best we can do. So first we measure the tricuspid valve annulus, which in this case is about 11 centimeters. We next measure the right ventricular wall. I'm commonly asked, where do you measure the right ventricular wall? Well, you could measure at the thickest area or thinnest area. It's best to measure the same way in every heart and at the same location. A good place to do this is the right ventricular outflow tract, because that's a place where you don't have a lot of trabeculations, so the thickness is uniform, in this case about 5.5 millimeters. That's thicker than normal. A right ventricle should be about 3 millimeters. This fits with our finding of downward displacement of the pulmonary valve leaflets. The pulmonary valve circumference in this case is going to be measured next. It's about 7.5 centimeters. We do know the patient probably had mitral regurgitation. The patient may have had developed some pulmonary hypertension that would explain the thickened right ventricle. Next we go to the left side of the heart. Again, we already said we thought the left atrium was dilated. We can measure the mitral valve the same way, which in this case is about 12 centimeters. Next we measure the left ventricular wall thickness. So where do we measure that? Again, we want to measure away from the papillary muscles where there are not a lot of trabeculations. A good place to measure is the posterior wall of the left ventricle behind the mitral valve. In the normal heart, the LV wall should be 1.5 centimeters or less. You always want to measure the septum as well, because in hypertrophic cardiomyopathy, the asymmetric type, the septum may be thicker than the left ventricular free wall. In this case, the septum is 1.5. The last measurement will be the aortic annulus, which is about 7 centimeters. It's very obvious that these are subjective measurements that depend on where you put your ruler and how hard you press down.